I'm going to introduce this scenario. My name is Megan Immel, and I'll be playing the role of the clinician. Next to me is Shannon Paptis, and she'll be playing the role of the client and using the pseudonym Candy. I'll discuss both the practice setting and introduce the client. So the practice setting takes place at the Phoenix House, which is a behavioral health treatment facility. They treat primarily substance abuse, but they contract with mental health providers to treat comorbidity. They have one inpatient facility and 4 outpatient branches. And the present assessment takes place at the outpatient branch in Hancock, Michigan. The outpatient branch consists of 3 counselors and 2 who specialize in women's needs. The client system is Candy, who presented at the Hancock branch voluntarily, requesting outpatient counseling to address opiate misuse after learning she had become pregnant. Candy independently sought medication-assisted treatment through Dr. Leighton of Marquette General Hospital, of which behavioral health counseling is federally required of the MAT program. Counseling persists through MAT, and the frequency of counseling is contingent upon patient stability. So let's get started. Candy, thank you so much for coming in today. Can you tell me a little bit about what brought you in, or a little bit about what's going on right now?
Hi, Megan. Yeah, thanks for meeting with me. I guess this therapy is mandated part of my treatment. I just started taking Suboxone. I've been abusing opiates for quite some time. I recently just found out that I'm pregnant. And I have a son who's 12. During my last pregnancy, I used, and Child Protection Services got involved, and they actually took my son from me.
Oh.
So, this time, this pregnancy was not expected or planned, and I'm just terrified that CPS is going to get involved again and potentially take my son. So I'm really hoping to not use during this pregnancy, just to keep CPS out of my life.
Okay. So you've had some past experience with DHS, and those clearly had an effect on you and your family. And this pregnancy was unexpected, but it sounds like it's very important to you, and that it speaks to the importance to some of the changes you're talking about making, reaching out for counseling and looking into the recovery process. Can you tell me a little bit about what you've done to start the recovery process for yourself?
Well, really, it's only been, I think, about 2 weeks, starting with the Suboxone. I mean, in the past, I have had times of sobriety. I used to own my own business, and things were going really well for a while, but I ended up slipping back into some use, and it just completely destroyed my life again. So, I guess just searching for help or reaching out for help has really been a big step for me. My partner, the father of my baby, resides with, we live together, and he's very supportive of me and my 12-year-old son. So he's on board, obviously, with just supporting me. And like I said, the Suboxone, it's been taking it for about 2 weeks, and I noticed the difference with my cravings.
So you started the Suboxone program about 2 weeks ago, you said?
Yes. Yeah, I've been taking the medication for 2 weeks now.
Okay, and so that was a big step in initiating recovery, and you said your cravings have diminished a little bit.
Yeah, because this is not my first time trying to get sober, I guess I'm concerned about, is this pill going to work? Is it just going to take all my cravings away? And thus far, it really has decreased my cravings, but I'm just concerned that I'm really afraid about, relapsing and CPS getting involved. But yes, at this point, 2 weeks in, it has decreased my cravings.
Okay, okay. So the concept of medication being kind of the solve all is concerning to you.
Yeah,
Um, it kind of seems maybe too easy of a fix for this situation.
right.
Um, can you tell me a little bit more about that?
Absolutely. I want to be successful.
What's that?
Well, I guess I really just truly want to be successful. And I just think that if a pill was like this miracle cure, everybody would be taking it. There's got to be more to it.
I
So,
see. I see what you're saying. With that anxiety that you're reporting during that process, or starting this process regarding the medication and it not being as effective as you want it to be, can you tell me a little bit more of that? Is that creating stress in everyday life? Is that interfering with your mental health at all, do you think?
I feel like I probably do tend to overthink things a lot, and get overwhelmed. Um, yeah, I guess just a lot of worrying, anxiety
Okay.
about worrying about the future, really wanting this to work, really not wanting to put my child, my unborn child through the system again. I
Okay.
have my own history, with my parents. I was in the system, and my siblings were in the system for a little bit too. So,
Oh, so this could be bringing up some old stressors and anxieties that you experienced in your history. So it might affect you differently than it does other people who haven't been involved with these programs before.
yeah, yeah. So myself, obviously my oldest son, and I don't want to continue that. I don't want to, put them through it again.
Okay, okay. And so that brings us back to your original goal, which is really launching this recovery process and and focusing on your personal needs right now, because if we neglect that, your stress level's probably going to rise. And stress is generally one of the largest variables that leads us to get closer to using or having problems in our recovery. How is your self-care right now? Do you feel like your emotional and relationship needs are being met? Do you feel like you're neglecting yourself in any way?
Um, well, I guess my thought is that my significant other is very supportive. At the same time, like there's never enough time in the day. I probably could do more for my self care. Um, I have a son, so he, all his needs and his needs and wants come first. And then if there's time left over, or if I, try to find time at the end of the day, then I might focus on myself or do something for myself.
I see, I see. So there's a lot on the table right now for you, Candy. So um I imagine that your mind is spinning to some degree with everything on your plate because you recently found out you're pregnant. You're making a giant life change, and you're initiating the recovery process. And it seems to me, you have very powerful motivation to not only initiate this process, but be successful in your recovery with the ultimate goal of keeping your family together. Um, it sounds like there's some stress with introducing itself with some of your history, with the involvement of DHS and losing some family members in those contexts. And sounds like there's just some stress with this process, which is very, very normal. I mean, I guess I'm impressed with how you're dealing with all this. And it sounds like you've got so much on your plate that you can neglect your own needs at some time on some occasions. So these are all important points, and I'm thinking, I don't know what your thoughts are, but I'm thinking it might be a good idea to start tracking where you're at emotionally and tracking where you're at in terms of self-care and stress and those things. Because if we're able to identify those and develop plans around those, that might really decrease the risk you feel compelled to use outside of the MAP program, or use or deviate from the MAP program is a better way to say it. What are your thoughts on that?
It's probably a good idea. I mean, just the regular daily stresses of life, but then also, with this pregnancy and, with my last pregnancy, I felt like my hormones were all over the place and up and down. And so if I start kind of tracking and getting some insight, I guess, to how I'm feeling now, that will probably be helpful in the future. I think probably in the evening, maybe if I can, make it like a habit before I go to bed or something, maybe I can try to, look back on the day a little bit and try to take some notes or something about how I was feeling.
Well, this sounds like a wonderful start, Candy. So we'll address all the points that we've mentioned in summarizing what we've talked about today, and get a start with logging what's going on a day-to-day basis, and that will provide us with a roadmap on what the next best steps are. Thank you so much for meeting with me today, and I think we can probably set up every week for now if you're comfortable with that.
Yeah, that sounds like a good idea. Especially being so, only 2 weeks in, I would like to touch base with someone weekly just to try to help with, accountability. I just want to be successful. So yeah, I think weekly is good.
Okay, we'll do that, Candy. Thanks so much for coming in today.
Thanks, Megan.